Good Wednesday morning. Happy EMS week to all my EMSers out there and for everybody else that may be wanting to watch and learn a little bit. Had this suggestion from Jason and I thought it was a great idea, so I was going to make it today's video. You can see I'm still not in the office. I'm still in my backyard. I'm actually off to teach CPR classes all day today, so I'm not sure when I would get a chance to do it later, so I thought I'd do the video the first thing this morning. Jason's suggestion was to discuss a little bit about why we sometimes fly a patient in a helicopter versus taking them by ground. And I don't know why this didn't come to me, because I get asked this question a lot when I'm dealing with patients and families. Not all hospitals are the same. Some are a little bit better at one thing versus another, and some are just sort of better all around. In North Alabama, our regional trauma center is Huntsville Hospital in Huntsville. So if you have major or significant trauma, that's where we want to take you. Now, the problem with that is not all of us live near Huntsville Hospital, so sometimes it may take a while to get there. And that's where the helicopters come in. They can get to locations much faster than a ground ambulance can. A 45-60 minute ambulance ride may be a 15-20 minute helicopter ride. And when you're dealing with major injuries, major trauma, time can make a huge difference. The faster we can get you to the hospital and get you to the trauma surgeons and get you into surgery where they can fix all the broken parts, the more likely you're going to survive. So when we arrive on a scene, and it's typically trauma patients that we fly, but when we arrive on scene, we begin to assess you and assess the scene and see what's going on. And there's four basic areas that we use to determine if we're going to send you to our trauma center or one of the more local hospitals. And our local hospitals are good, they just can't always manage everything that can be involved in a multi-system trauma patient. So the first thing that the Centers for Disease Control has us look at, and the Centers for Disease Control put out these guidelines. State of Alabama with our medical control physicians have looked at that and revised it just a little bit, but it's pretty similar, and that's what we use as paramedics and EMTs here in Alabama. So the first area that we look at are things like your vital signs. So if you have a very rapid or very slow respiratory rate, or if your heart rate's very fast, or if your blood pressure is low, or if your level of consciousness is not where it should be, you're a little confused, or if you're completely unconscious, then we will want to take you to a trauma center. The second thing we look at are your injuries. So if we do our head-to-toe exam and we find a bunch of broken bones or your broken pelvis, or we think you have some internal bleeding, then we want to take you to the trauma center because they have all the specialties there at our trauma center that could manage any sort of problem with any internal injury. The third thing we look at is the mechanism of injury. And I'm not a big fan of mechanism of injury, but we do have to consider it. If you are walking down the road and somebody runs up on the curb and hits you and they were traveling 20, 30, 40, 50 miles an hour, you're probably going to a trauma center. If you were not restrained, meaning you didn't have your seatbelt on in a car and it flipped several times and you got bounced around and banged up, you're probably going to a trauma center. The last thing we look at are there any other factors? So our very young children just don't seem to respond as well to trauma, and our elderly patients don't respond to significant trauma as well either. So we like to get them to where they can have the best care. And if you have a bunch of medical conditions, we will probably also want to send you to the trauma center just because they have all the specialties there, and that way they can manage everything that might be going wrong with you. So those are the four things that we look at when we're determining whether you need to go to a trauma center or not. Now, whether we go by helicopter or not really depends on how far we have to go. And if we think it's going to save you time, significant time, generally more than about 5 to 10 minutes, then we're going to want to fly by helicopter. Now, in the past, it used to be we would arrive on scene, we'd assess the patient, we would then call, and the helicopter would then launch and fly to us, and that was always a delay in time. So something that many helicopters do, or many dispatch systems now do, is they do pre-launch criteria. So based on what the 911 caller says, the dispatcher may determine that this is a significant injury or significant mechanism and automatically launch the helicopter or call a helicopter. The helicopter will then, the crew will then determine if it's safe to fly with weather, and then they will pull the helicopter out of the hangar, do their pre-flight check, get things started up, launch the helicopter and start flying to the scene. And by doing that pre-launch criteria, we can get them in the air and get them to the scene much faster than what we used to do. Now, do we always need them? Nah, sometimes they get canceled and they go back to their base and they land and they go back to doing what they were doing. This is a pretty significant cost to them to be able to launch anytime, even if they're not needed, and no one has truly gotten eyes on the patient yet. So we appreciate them willing to spend that because it does get them to the scene much faster. And once we get on the scene, we give them a report, they take over care, and there's a few things that the helicopter crew can do that the ambulance ground crew can't do. So sometimes we need them just for some advanced procedures or medications. But we use them and primarily to get you to the level 1 trauma center as quickly as we can. So hope that helps explain why we use our helicopters. If you ever have any questions about it, message me, call me, put it in the comments below and let me know. If you want to see other of these videos, I load all these into YouTube, and you're welcome to go to my channel there. Just search by my name and you'll see my channel, and make sure to like and subscribe. We still have Thursday, Friday of EMS week, so there'll be a couple more of these coming out. And if you have any ideas like Jason did, message me or put them in the comments below. I'd love to hear from you, and I'd love to answer some of your questions. Thanks, and happy EMS week.